Hey folks, Dr. Joe Esposito here. Glad you're with me today. We're going to talk today about the long-term implications of taking medication and what it does to your gut. Now, let me start by saying I'm not against medication. If you need medication, absolutely take it. But I want you to understand not just the side effects of the drug, but what are the side effects of long-term use and what it does to the bacteria, the microbiome in your intestines. It's pretty serious stuff. So your gut is so important to good health. Your gut is the core to good health. And I talked about this 40 years ago. I remember talking about the gut and how it's, disease starts in your gut. And now it's actually being taught in medical schools. It's being taught in chiropractic schools and osteopathic schools. It's really cool stuff. But most people don't think about it. Now think about the abuse you give to your gut. You just beat yourself up with the gut. You eat bad foods, you don't drink enough water, you get stressed out, and now the digestive system suffers. I mean, isn't it amazing how your body can take, a cookie and somehow break it down and turn it into muscle tissue? It's phenomenal. We beat ourselves up. The gut has its own nervous system. You have the central nervous system, which is your brain and spinal cord. You have your peripheral nervous system, which are the nerves outside the brain and spinal cord. And then you have your enteric nervous system. I bet most of you never even heard the word enteric nervous system. It's the nervous system that specifically controls your digestive system. It's so complicated and so complex that it has to have its own nervous system connected to the central nervous system. The big connection is through something called the vagus nerve, V-A-G-U-S. Now, there's two vagus nerves that come out of your head and they go down into your digestive system. And it controls digestion, but the vagus nerve also controls your heart, controls what's called the parasympathetic nervous system. Parasympathetic nerves slow you down. Sympathetic nerves speed you up. Parasympathetic nerves slow you down. So there's so much involved in your digestive system, and yet most people just beat the heck out of it day after day after day. And so we've got to stop doing that. 90% of common drugs alter the gut microbiome, the bacteria composition. So high blood pressure, diabetes, obesity, cancer, over-the-counter medications, they're going to affect the gut microbiome. Microbiome is the bacteria in your colon. Now, almost half of those changes will stay there even after the medication stops. So we can stop taking the medication. We've still altered the microbiome. We have to now fix the microbiome. Now, if I said what one drug is going to have the biggest impact on your gut, most people would say antibiotics. And you're absolutely right. Antibiotics kill off good bacteria, but they also kill off bad bacteria. So we're trying to kill off the bad bacteria. In the process, we're killing the good guys. And one of the problems with antibiotics, many problems, is that it'll kill bacteria, but it won't kill yeast. And yeast grows in your colon. And if you start killing off the bacteria, the yeast don't have any competition for food, so the yeast starts to multiply. And then the yeast says, I'm bored. I don't like it here anymore. I want to go on vacation. So it'll sneak through these little gaps in your colon called leaky gut syndrome, get into your blood system, and now the systemic yeast can travel and settle somewhere else. And many times the yeast will settle in warm, moist places. Crotch, your feet, if you have folds of fat underneath the fat. And now we have what we call a systemic yeast infection. Now we can give you drugs to kill off the systemic yeast infection. Seems to work pretty well. However, the drugs now have side effects by affecting the liver and can affect the microbiome as well. So Elvis Presley said, I'm caught in a trap. I can't walk out. And that's what's happening. You need the medication for one thing, but it's causing another thing. I know I had a systemic yeast infection for a long time, and years ago I took drugs, and it killed it, but it came back. And then I had the effect on it. So it turns out I was low in certain supplements, and I took certain supplements, and it really helped tremendously. I took selenium, and when I started taking selenium, it started killing off my yeast. Now, I'm not saying you should take selenium because too much of it can be toxic. I did a test on myself, found that I was selenium deficient, and I fixed my selenium deficiency, and my yeast infection went away. So there are natural ways we can approach these things. Sometimes you need the drugs. I'm not saying you don't, but we need to fix the damage. So even if you just do even 2 or 3 or 4 rounds of antibiotics, that can cause long-lasting distribution in disturbances in the microbiome. So the microbiome, we kind of laughed at it years ago. We didn't think it was a big deal. And now we're doing things like fecal transplants. If you haven't heard of this, this is pretty wild. So we know that skinny people have different bacteria in their colon than fat people. We know that healthy people have different bacteria than cancerous patients or patients with heart disease. And so they're taking the bacteria from healthy people out of their colon, no kidding, and implanting it into sick people and getting results. They've even had children with autism where they've done fecal transplants and seen results. So the bacteria in your colon is so important. And yet for some reason, we've been ignoring it for years. Take the antibiotics, don't worry about it. If you ever had antibiotics, anybody ever have them? I have. You take antibiotics, did anyone ever say, now we got to fix the damage that the antibiotics caused? Probably not. They may say, oh, take some yogurt as a probiotic or something like that. Yogurt is pasteurized, unless it's a raw yogurt, is pasteurized, so it kills off the good bacteria. So even taking yogurt isn't going to solve the problem unless you take a raw yogurt. And I'm not a fan of dairy products because there's an inflammatory reaction in the gut. So there's supplements you can take. There's food you can eat. We're going to talk about that in the second part of today's show. We're going to talk about the proactive steps that you can take to fix the damage. The damage can be there for decades. And you have to go in there and say, okay, do I have this problem? What do I do about it? Now, when I was young, antibiotics are really cool. No matter what it was, they gave you antibiotics. I remember Dr. Waltman was my doctor. And I remember his office. He had a big glass block wall in his office. I just remember that as a kid and thinking that was so cool. And Dr. Waltman, whatever you had, runny nose, itching, scratch, whatever, gave you antibiotics. Allergies, antibiotics. Because at the time, they had just come out and they were a miracle drug. They cured everything. And I remember being a kid and having horrible sinus problems and blowing my nose and coughing all the time. And my mother giving me round after round of antibiotics and then giving me an antihistamine. And it was called, I used to call it the Easter pill because it was this multicolored pill, looked like an Easter egg. And it was very bitter. In fact, just saying it now, this is decades later, I can still taste it. Trying to treat the symptoms. Never realizing that my problem was I didn't do well with wheat and dairy products. And what did I have every day as a kid? Wheat and dairy products. Now, this is decades ago, before the wheat was hybridized, before they used glyphosate on it. So it's a very worse world now than it was then. And even then, I was having issues with it. So those antibiotics, I'm sure, killed off a lot of my good bacteria. And then we have to say, what do I do? How do I fix this? So non-antibiotic drugs can also affect the gut microbiome, including heart, anxiety, steroid medications. So we can kill off this bacteria many different ways. How about chlorine? Chlorinated water can kill off bacteria. Fluoride, I don't know if you've heard, we're trying to pull fluoride out of all the public water systems. Very happy to hear that. Because fluoride on your teeth seems to work. If I put a fluoride treatment on my teeth, it can help prevent cavities. But if it's in the water, you're swallowing it. It goes right into your gut, doesn't affect your teeth. So it makes no sense. It has to be topical. When it goes into the gut, it doesn't do anything. So that becomes an issue. And so I'm very happy to hear we're making these changes and getting fluoride out of the water, because to me, it makes absolutely no sense. If it made sense, I'd say, okay, let's talk about it. Give me a pro and a con. I don't see any pro. It's only con. But chlorinated water can kill off the bacteria in your colon. If you're eating meats and dairy products that have antibiotics in them, you're eating those antibiotics. That can kill off the gut microbiome. Not totally kill it off, but affect it, adversely affect it. So there's so many things that we're doing every day to mess with it. Anxiety medications can hit the microbiome just like antibiotics. Surprising, and it's also concerning, but how many people are taking anxiety medications? A lot of people. It's a big issue. Now, when it comes to anxiety and depression, I'm going to go off on a tangent here for a second. I want you to consider looking at your digestive system as a player and the cause of it in many cases, but in many cases, it's the stomach. Your stomach has one main job, and if you listen to my shows before, I talk about this a lot. Stomach's main job is to digest protein. Now, you can get protein from a carrot, you can get it from a steak. Your stomach takes the protein, which looks like a ball of yarn, unravels it, and chops it up into something called amino acids. The different amino acids, the amino acid tryptophan becomes serotonin, which goes up into your brain and helps you focus, makes you happy. Serotonin becomes melatonin, which helps you sleep. So many times if we have anxiety and depression, we're not sleeping properly. A lot of it has to do with the gut not breaking the protein into amino acid tryptophan to give the brain the raw materials that it needs to produce the neurotransmitters. Tyrosine becomes dopamine. Dopamine gives you pleasure. Dopamine becomes norepinephrine, which gives you energy. Glutamine becomes GABA. GABA suppresses pain. Had a patient this week. She came in, and young girl, probably in her 30s, and she said, listen, I've had a hysterectomy already. I've been depressed my whole life. I've had eating disorders. I can't lose this weight, even when I work out. And I'm really stuck. I have severe depression as well. And her husband was in the room with her. And we talked for a little bit. And as they're talking, I'm writing all this stuff down. And I said, how's your digestive system? Horrible. I let her talk. I wrote everything down. And I explained to her what I just explained to you. Digestive system has to work to break proteins into amino acids to produce neurotransmitters. Of course your brain can't work. It's impossible. And she said, I've been to all these different doctors. Nobody's talking to me. They just prescribe more medication. At one time, she said she was on 30 different medications. Now, those 30 different medications are certainly have an impact on her gut microbiome, the bacteria in her colon, which is now affecting the production of neurotransmitters, which is affecting her brain. Wow. So my approach when it comes to healthcare is let's find out why you have these health problems. Why do you have neck pain, back pain, shoulder pain, anxiety, depression, high blood pressure, diabetes, obesity, heart issues? I'm not saying I can cure it, but let's put together a protocol to try to get you better. And in many cases, it does go away. Countless patients, it goes away. And patients say to me all the time, how come my other doctors never told me this? How come I've never heard of this before? And my answer is always the same. Nutrition is not taught in medical school. And if it is, it's a very, very short course. I've studied biochemistry, nutrition, digestion for 40 years. And I still learn new stuff every day. So I can't expect a doctor, a medical doctor, to know this because that's not their field of expertise. What's the number one killer in the United States? Heart disease, diabetes, cancer? It's diet. Diet's linked to all these other problems. So if we could change the diet, we can change the outcome of so many different diseases. Not saying it's a cure, but changing the outcome for a positive way dramatically. If you study the news lately, they just put out a new food pyramid. I'm not unhappy with it. A couple of things I would change, but generally speaking, I like it. Lots of fruits, vegetables, nuts, and seeds. Meat and dairy, they added in there. I wouldn't have added those in, and if I did, I'd say make sure it's organic, but that's the only issue I really have with it. And then processed sugar, zero processed sugar. If you're going to do alcohol, extremely small amounts. And I think they did that. Listen to the people that did it, RFK Jr., Dr. Oz, people like that, was that we can't tell people not to drink. They're going to do it anyway. So if you're going to do it, at least do it smart. I always say if you're going to drink, take an extra dose of Dr. Joe's Super Greens, Dr. Joe's Essential Source, and Dr. Joe's B Complex to mitigate the damage of the alcohol. So I'll negotiate with you. I don't drink. But if you're going to drink, at least mitigate the damage with Super Green Essential Source and B Complex. You should be taking that every day anyway. Everybody should. Take it as a second dose if you're going to go out drinking at night. So very happy with the changes. Taking the artificial dyes out of food. Very happy with that. Excited about the fluoride in the water. So we're seeing good progress, finally, for the first time in my life. Take advantage of this, folks. It's not just me. Everyone's getting on rooftops and shouting now. Hey, maybe there is something with our food. Maybe food is linked to disease. It is. And the nice part is you control what's on the end of your fork. Now, most people never think about medications and microbiome. Now, we have an obesity issue. One thing that your body does, if you eat a lot of fiber, you have bacteria in your colon that produce something called short-chain fatty acids. Maybe a new word for you. Short-chain fatty acids go out into the body and tell the body, you're full, stop eating. Goes into the hypothalamus and controls a lot of different things. And it also, one of the short-chain fatty acids is called butyrate. Butyrate activates something called the L cells in your small intestine. I know it's a lot of blah, 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 big words. And the L cells release something called GLP-1. Anybody ever hear GLP-1? It's those drugs everybody's taking now. And again, if you release it in small amounts, naturally, your body starts to feel full. When you take excessive amounts, unnatural amounts, like the drugs, the body gets overwhelmed and basically says, I don't feel like eating at all. And now I see people going into malnutrition. I see the bowels shutting down. And we're going to see long-term side effects, I promise you, from these GLP-1s. And the research keeps coming out. Oh, it helps with heart disease, helps with cancer. No, it helps with you stop putting junk in your body. I believe that's why you're seeing the results. You're just not eating junk anymore. What if we just stopped eating junk? What a concept. I know. Something different there. So if you have, back to depression, so if the stomach isn't breaking proteins into amino acids, we may have to actually physically pull the stomach down away from the diaphragm and get it to relax. Many people, the stomach is pushed into the diaphragm and it's spasming. Pull the stomach down, get the stomach to relax, start digesting the food properly. I personally take Dr. Joe's digestive enzymes every meal, if it's cooked. If I eat a salad, I don't take it. But I made a bunch of soup last weekend because I like to cook for the week. And it was a vegetable soup. I took rice. I cooked the rice, put it in the refrigerator overnight, organic California rice, less arsenic, and then I added it to the soup. Why did I do that? Because when you cook the rice and cool it, you create something called prebiotics, resistant starches or prebiotics, to feed the good bacteria in my colon to produce things like butyrate to activate my GLP-1s, to produce chemicals that help my immune system, that help my brain work better. So these are cooking hacks, health hacks, that I want you to start incorporating into your life. Now, if you have a health issue, I want to be your doctor. I threw a lot of stuff out in the past 16 minutes. But if you have health issues, neck pain, back pain, shoulder pain, digestive issues, brain fog, supplement concerns, make an appointment to come see us. Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Normally, the first visit is $940. I've reduced that for you, my listeners, to $299. That's an exam, x-rays, consultation, first treatment going over the x-rays, and a complete nutrition evaluation. Cost for that, $299. Any one of those services is going to cost you more than that. I do it because I want to find out what's going to be the best course of treatment for you. Is it chiropractic? Is it a naturopath? Is it orthopedist, neurologist, neurosurgeon? I don't know. And you don't know either. So let's put together a protocol and find out where is going to be the best place for you to go to get to the cause of your problem and not just treat the symptoms. You can book an appointment directly on our website, drjoe.com, drjoe.com. We accept almost all insurances, car accidents, sports injuries. We're even on the VA referral list. So make your appointment, drjoe.com. If you have questions about anything, send it to me through the website, drjoe.com. Happy to answer your questions for you, drjoe.com. Book an appointment. The supplements we talked about, Super Greens, Essential Source, nitric oxide opens up the blood vessels and increases circulation to the brain, the heart, the reproductive organs. That's another one of my favorites. Men's hormone support. As I get older, my hormones are dropping. There's herbs like Tribulus, Tongkat Ali that can actually build up my testosterone levels again, naturally. We have omega-3 fatty acids, essential for brain function. I think we have 28 different supplements. We have gut microbiome, Gut Guard. Gut Guard is one of my favorite. It helps replace the good bacteria in your colon. We have probiotics, replace the bacteria in your colon. Daily Purify to clean out the liver, because all of us beat our livers up every day. We have so many different supplements. But a minimum would be Super Greens, Essential Source, Vitamin D, and B Complex. All of them on the website, drjoe.com. I really want to be your doctor. But the best thing you can do is make an appointment. In the Atlanta area, again, Marietta, Duluth, and Stockbridge, drjoe.com. And if you're not in my area, I could probably try to find you somebody, but I don't know of anybody who does what we do. That's why I'm a patient here too. I'm a patient at my office as well. So we're talking today about long-term medication, how it affects your gut. Another issue we have is polypharmacy. If it's just one medication, we can kind of look at the side effects. But when you start mixing 2, 3, 5, there's no way of knowing what's going to happen when you mix these medications in this dosage in your body. And a lot of the polypharmacy is going to start killing off the bacteria in your colon and affecting the gut in a bad way. So what I want you to do, and we're going to come back in a second. When we come back, I'm going to talk about we're going to call it bulletproof your gut. Look at your pharmacy, look at the drugs you're taking and say, are there any medications I don't need to take? Talk to your doctors. Sometimes you have different doctors giving you different prescriptions. What can I cut back or cut out? And then if you want to come see us, let's see if there's any natural protocols that might be able to reduce or eliminate the need for the medication. Don't stop the medication. Keep taking it. Let's get you well enough so you can go back to the doctor and say, Doc, can I stop this now? Every day I have patients come to me and say, my doctor said I can reduce my medication. My doctor said I can drop out that medication. What a great job I have. I got the best job in the world. So think about it. Recovery is possible. Your microbiome, the bacteria in your colon, are transient. So you can build it up if you need to with certain supplements, with certain foods. Sometimes it's physical. The stomach is up against the diaphragm. Sometimes a pinched nerve going to the digestive system. But we have protocols for just about everything. And let's put together a protocol specifically for you. Wouldn't that be nice? What to eat, what not to eat, what supplements to take, what about the structure in the spine. Let's see what we can do to get to the cause of your problems and not just treat the symptoms. It's unique in healthcare, but I truly believe this is the trend. And 100 years from now, they'll be talking about Dr. Joe's protocols and how amazing they were. And why didn't everybody do it at that time? Because now it's, I believe, I hope I'm around, that this is going to be the standard of healthcare. Because it makes sense. Now, you're going to need emergency medicine. Absolutely. You're going to need surgeons. You're going to need orthopedists, neurologists. You're going to need gastroenterologists. But let's incorporate all this to make it so that we now have a chance for the body to get well. Every day, patients come in our office and they say this. They say, Dr. Joe, why didn't I do this sooner? And my answer is always, I don't know. I don't know why you didn't do it sooner. I wish you did. And they always say, I wish I did too. So don't wait. I don't want you to wait till it's too late, because sometimes people come in and they're so far gone. It's like, guys, I can only give you a little palliative relief. I'm not sure I can fix this thing. The sooner we get to a problem on anything, the better it is. Whether it's cancer, an orthopedic problem, a neurological problem, the sooner we get to it and start treating it, the better it's going to be. I'm not saying I treat cancer, but we can get the body healthy so that the body can respond more in a positive way. Wouldn't that be nice? That's my goal is. I want to make everything nice for you. But gut disruption affects more than digestion. It affects immunity, affects metabolism, affects inflammation, mental health. Like we said, neurotransmitters are made in the gut and sent to the brain in most cases. So let's fix the gut. Stop beating it up. Talk about the 7 deadly sins of nutrition, the 7 foods you want to avoid. Those are alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, every day patients come to me too and they say, well, Dr. Joe, I ain't giving up my meat. Okay, don't. I'm perfectly fine with that. But at least let's do organic meat so you don't have all the chemicals in it. I'm not giving up my alcohol. Okay, let's take Super Green Essential Source and B Complex. I'm not giving up my artificial sweetener. Okay, let's use stevia or Lohan instead. So we have answers to your questions, believe me. I've been answering questions for 40 years, 7 days a week, sometimes 24 hours a day. I get questions through my website, drjoe.com. So I pretty much have answers for you. And I'm not saying you have to do everything, but let's start moving in that direction. I'm looking at the clock. I got to take a break. Hey, folks, Dr. Joe Esposito. If you're just joining us, welcome. If you stayed with us, I appreciate that. We're talking today about a really serious topic. We're talking about long-term medication use and its impact on the gut. And when I say the gut, I'm talking about the microbiome, the bacteria in your colon. You have over 100 different types of bacteria, some good, some bad. And it's the key to your health, your mental health, your immunity, your growth, your weight loss. And if we start killing off the good bacteria in our colon, we got some real serious problems. And we're doing it every single day, especially with medication. If just tuning in, we said about 90% of common drugs have a negative impact on the bacteria, the microbiome in your gut. How many people are on medication right now? Raise your hands. A lot of you are. How many are on more than one medication? A lot of you are. Let me say this. I'm not against medication. I'm against the unnecessary use of medication. For example, high blood pressure. I could probably do a show every week on high blood pressure and people would listen because so many people have it. High blood pressure can be from the stomach pushed up against the diaphragm. Crohn's, colitis, irritable bowel syndrome affects something called the vagus nerves. And the vagus nerves also control the heart. So if the vagus nerves are irritated, it can send an impulse over to the heart and cause the heart to beat harder. Countless patients, we fix their gut and their blood pressure normalizes. Countless. So maybe that's your cause. Maybe you're low in something called nitric oxide. Nitric oxide is a supplement. I take it, nitric oxide support. I take it every day. Opens up the blood vessels and increases circulation to your heart, your brain, your liver, your sex organs, everything. And so nitric oxide lowering could cause the blood vessels not to open up properly and raise the blood pressure. Pinched nerve in the neck, the atlas, the top bone in the vertebrae can come out of place. There's been studies done on blood pressure and atlas adjustment, putting the atlas back in place and lowering blood pressure. Could be due to pain. There's so many different things that could be causing high blood pressure, but the diagnosis oftentimes is what? High blood pressure. What caused it? I don't know. Iatrogenic means we don't know what caused it. But here's the medication. We know that's going to lower it. Yeah, but what about side effects? Well, you got to lower the blood pressure. What about side effects? Yeah, but you got to lower the blood pressure. So it becomes this battle. I was going to say something I probably shouldn't say. um, Orthodox medicine is not taught nutrition, generally speaking. And it's certainly not taught the level that I've been studying for 40 years. So I'm not expecting my doctor friends to do it. Just this week, I had a doctor come to see me. She came to see me. She works in an orthopedic clinic. She came to see me. She wanted me to review her blood work for her. She sent her husband to me for chiropractic care. Had another patient who works for a chiropractor. Said, go see Dr. Joe and his staff because I do regular chiropractic. We don't do the functional medicine stuff that he does. So we get referrals from orthopedists, neurologists, neurosurgeons, chiropractors coming themselves because it's not something they're taught. If I need knee surgery, I'm going to go to an orthopedic surgeon. If I need spine surgery, I'm going to go to a spine surgeon. But who teaches this functional medicine stuff? We do. That's why I want to be your doctor. And if you like what you're hearing, obviously you do, you wouldn't be listening, this is the approach that we take. So let's talk about bulletproofing your gut. Let's talk about a recovery plan. I can go on and on and on about listing why the medications are bad. Let's stop that. First of all, of course, reduce the unnecessary medication. Get to the cause of the problem. If you come see us, we'll try to see if there's a natural protocol we can do. Years ago, not even years, about a year ago, my surgeon friends were coming to me and saying, Joe, I can't get surgery done on these patients because they have high blood pressure, diabetes, obesity, they smoke. I can't get medical clearance. Patients can't get the surgery that they need. Doctors can't get paid. Nobody wins. So they'd send them to me and I'd say, all right, John, you have high blood pressure, follow this protocol. Bob, you smoke, follow this protocol for addiction. You're overweight, follow this protocol that I put together. You have diabetes, let's do a nutritional protocol to lower the A1C and lower the risk of type 2 diabetes. And we got a lot of patients well enough so the surgeons could do surgery on them, and they loved it. And the patients got healthy, so the surgery probably turned out better because the patient was healthy. All right, so reduce the unnecessary medications, get to the cause of the problem. That's where we come in. Let's see if we can put together a protocol specifically for you. You want to eliminate inflammatory foods. These are foods that cause inflammation in the gut. And they are the big seven, the 7 deadly sins of nutrition: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Now, if you don't know what they are, send me an email, say you want the 7 deadly sins. I'll send you the course that I did. I did a lecture in California, I'm going to guess maybe 20 years ago on all this. Yeah, at least 20 years ago. And I'll send it to you absolutely free. And you could listen to it. And I'm asking you, I know you may not cut them all out, but at least cut back. Make decisions. And you want to cut out the new words, since 20 years ago, ultra-processed foods. If it comes in a package and you can't read all the ingredients and understand what the ingredients are, don't eat it. That's probably an ultra-processed food. And the seed oils, corn oil, canola oil, soybean oil, cottonseed oil, sunflower oil. The seed oils cause a lot of inflammation, and they are in just about every food out there. The only oils you should have in your house: extra virgin organic olive, extra virgin organic coconut, and maybe avocado if you want to. That's it. Those are the safest ones. And with olive oil, what you do is when you buy it, put it in the refrigerator. The next day, look at it. If it got cloudy, it's a good olive oil. It's a quality olive oil. If it didn't get cloudy, chances are it's been cut with things like soy oil or canola oil. Bring it back to the store. It's junk. Corn oil, soybean, again, olive oil, coconut oil, and avocado oil. That's it. The only oils you should ever use. Add it to your foods. So cut out those seed oils. If you're going to drink, please don't. But if you do, you want to make sure you take an extra dose of Super Greens, Essential Source, and B-Complex, which, by the way, everybody should be taking that every day anyway. You're going to take a second dose to mitigate the damage from the alcohol. We have stevia, Lohan, xylitol. These are all substitutes for sugar and substitutes for artificial sweeteners. If you're going to do meats and dairy products, limit them, which is what the new food pyramid says as well, which I'm happy with. They didn't say at least do organic meats, because otherwise the meats will have steroids, chemicals, hormones, antibiotics, genetically modified food, glyphosate. In most cases, you don't want to eat that. So cut that out too. We got to calm down the gut lining. You want to eat easy to digest, low irritation foods. So if you have Crohn's, colitis, irritable bowel syndrome, you're gassy all the time, you're bloated all the time, simple, easy to digest foods. Like, for example, fruit, but just one at a time. You can maybe have tangerines or watermelon, but don't mix a bunch together. Again, it's going to take time for the body to heal, and once it does, you can go back to mixing it. If raw foods blow you up, I always recommend have something raw at every meal, but if you're going to eat a raw food and your stomach cramps, or you bloat, or you get gassy, maybe we're going to have to eat cooked vegetables for a while, and then slowly wean you on to a little bit of raw food. White rice, sweet potatoes, very easy to digest. If you can do white rice, organic, California rice. That's the one with the lowest amount of arsenic in it. Sweet potatoes and rice, cook them, cool them overnight. You can eat them the next day or the day after. But when you cool it, you change the composition of the carbohydrates, a lot easier to digest. And you're going to absorb about 30 to 40%, maybe 50% less carbohydrates as well. And you create a resistant starch, which then feeds the good bacteria in your colon. It becomes a probiotic. So you're seeing it's not hard. It's easy. You want to eat slowly. You want to chew your food. If you can handle it, a tablespoon or two of apple cider vinegar every day will stimulate stomach acid production, help you digest your food more efficiently. I don't like apple cider vinegar. I don't like vinegars. I don't like tart flavors like that. It's my flavor. It's my taste. So what I'll do is I'll use it as part of a salad dressing. And then it kind of covers it up, and I get my 2 tablespoons every day because I have a salad every day. I take a digestive enzyme. I take Dr. Joe's digestive enzyme whenever I eat a cooked meal. And let me tell you, as you get older, over 40 especially, taking a digestive enzyme is a game changer. It breaks down your food more efficiently, less bloating, go to the bathroom better. It's just crazy because our enzyme levels are dropping. It's getting old. Easy fix and very inexpensive. All of my fixes are very inexpensive too. We always say the minimum supplements would be Super Greens Essential Source, B-complex, and vitamin D. If you took that every day, $5 a day. I know you're spending $5 on stupider things. I know you are. Stop spending on stupid things and ultra-processed foods and coffees and things like that and get the Super Green Essential Source B-complex and vitamin D. I take a lot more supplements than that. You should too. But I'm willing to go slow. You got to repair the gut lining. Now, 2 supplements that are great for that, Dr. Joe's Daily Purify, it's a powder, and Dr. Joe's Gut Balance. Great start if you have digestive problems. Okay, so I take those every day. Once the gut is healed, you probably want to do it about 2 or 3 months, and then if your gut is doing well, you could probably cut back on those 2. But it's Dr. Joe's Purify and Dr. Joe's Gut Balance. Simple products. Easy, inexpensive. I don't know how to make it easier for you. I honestly don't. If you can come up with any suggestions on how I can make this easier for you, send me an email through the website, drjoe.com. As long as it's reasonable, I'm happy to address it. Don't be saying stupid things like, oh, bring it to my house and make it for me for free. I'm not going to do that, okay? Reasonable requests, I'm happy to answer it for you. So we're talking today about how medication adversely affects the bacteria in your colon, the microbiome, and how that affects everything from immunity to mental health to weight gain to breath to bowel function to romance. Because everything you eat has to be broken down, absorbed, and that's where it happens in the gut. So if we have these digestive issues, we said many times the stomach is up against the diaphragm. We need to gently pull the stomach down away from the diaphragm. Get it to relax, put it back in place so it can work better. There's a valve between your small and large intestine. It's called the ileocecal valve. And many times that's stuck closed. You have constipation, stuck open, you have diarrhea. There's a way I can teach you to massage that and just get it to release. Then we start putting the good foods in the body. We take things like Dr. Joe's Daily Purify. We take the Gut Balance. We take Super Greens Essential Source, vitamin D, B-complex. And let's start giving the gut the nutrients that it needs so we can start to repopulate the colon with good bacteria and start to kill off some of the bad bacteria. You always have good and bad. It's never going to go away altogether. But let's see if we can get the balance leaning in your favor. And in most cases, we can. And when you fix the gut, let me tell you, man, life changes forever. Autistic children, they've done so many studies on autistic children. We get them on supplements, we get them on methylated B-complex, we get their gut balanced out, and we see dramatic improvements. Now, it may not be a cure-all, but amazing. Anxiety, depression, bipolar, ADD, ADHD, we fix the gut, amazing improvement in most cases. So why wouldn't you do that? You want to stabilize your blood sugar. So the new food pyramid says no added sugar. I like that. But what else can we do? Cinnamon is great for stabilizing blood sugar. I add cinnamon to my Super Greens and Essential Source every morning. I take Super Greens and Essential Source, a scoop of each. I get some coconut milk, ramen milk, or sometimes water. I'll add cinnamon. I'll add creatine to help keep my muscle mass strong and my brain working. I add Dr. Joe's vitamin D3 with K2, and then I add Dr. Joe's magnesium. So I have like 5 ingredients. I mix it into my Super Green Essential Source, shake it up, and drink it. Then I take my handful of supplements. That's how I start every morning. You should too. Supplements are not a luxury, they're a necessity. Having proper structure, bones lined up, stomach in the right place, unpinched nerves, muscles balanced, it's not a luxury, it's a necessity if your goal is to have good health. So if you want to make an appointment to come see us, whether it's neck pain, back pain, shoulder pain, digestive issues, nutritional concerns, drjoe.com, drjoe.com. Let's check your nervous system. Let's check your digestive system. Let's look at what you're eating and what you're taking, and let's customize a plan specifically for you. I don't know why you're not doing that. I cannot, in my wildest dreams, come up with an answer as to why you're not doing that. So drjoe.com. And again, normally the first visit is $940. For you, my listeners, I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Why are you not doing this? drjoe.com. Book your appointment. And we accept insurances, almost all insurances. I can't make it easier for you. I spent 40 years trying to figure out ways to make it easier for you, the patient. I think we've come up with a way. So stabilizing the blood sugar is important. So stay away from the processed foods, the grains. If you're going to do rice or anything, make sure it's a resistant starch. Put it in the refrigerator overnight. Cinnamon, stabilized blood sugar. Vinegar, stabilized blood sugar. We have Dr. Joe's Glucose Guard. That's on the website, drjoe.com. It's berberine, great for stabilizing blood sugar. Chromium. So we have all the tools for you. If you can't remember any of this, just send me an email, and I'll send it over to you. Introduce probiotics slowly. This is something that I've had people go to other doctors, and I'll say, here, take these products, and it's going to fix you up. Too much, the probiotics kind of blow up, and you get all bloated, you get gassy, you don't feel good. So you can start out with Dr. Joe's Probiotics and Dr. Joe's Essential Source. Both of them have probiotics in them. Let's start there, nice and gentle. Let's see how we do. Monitor your gut. You know, we talked about gut balance as well. You can take that as well. If you start seeing bloated or something, maybe cut back to half a dose and see how you do. Wait about a week and then add the other half of the dose. Everybody's different. I don't know what's going to work for you, but I know the protocol that we need to do to find out what is going to work for you. You can start eating fermented foods. Sauerkraut, kimchi, coconut kefir, not daily at first, but a little bit at a time. So think of these things as a medicine, not a condiment. So with sauerkraut, one of the problems is, and same thing with kefir, it's pasteurized. And when it's pasteurized, it kills off the good bacteria. But sauerkraut, cabbage, has this natural probiotic in it. That's why it's so easy to make sauerkraut with it, because there's probiotics already in the cabbage. So what if we just ate some cabbage? Maybe have some organic cabbage, and you could try it raw. If not, you can cook it. The other day I had cabbage and beans. Very gassy meal, right? I took Dr. Joe's digestive enzymes. Problem was solved. So you say, well, I can't eat that stuff. I get gassy. All right, take an enzyme and see if that helps. If not, that means you're not digesting your food properly. Another reason why we have to slowly introduce these things. If you can get a raw sauerkraut, or you can make your own even, but raw sauerkraut, maybe just a forkful. Do it for a couple of days, see how you do. Then do 2 forkfuls, and then 3 forkfuls. Start to slowly introduce these prebiotics and probiotics into the colon so you can recolonize the colon. Like we said, gut balance, Dr. Joe's Essential Source, Dr. Joe's Probiotics, all great ways to start building up that good bacteria in your colon. And if you got to fix the physical too. The physical issue, like the stomach out of place, many times needs to be addressed and many times is never talked about. So then we start adding prebiotic foods as well. Garlic, onions, leeks, asparagus, even green bananas. Steel-cut organic oats. These are good prebiotics that feed the good bacteria. And maybe do a little bit at a time. I know if I eat too much garlic at once, I'll get real blown up. I'll get all bloated. So I have to eat a little bit at a time, and I want to take a Dr. Joe's digestive enzyme with it as well. You want to increase the butyrate production. We talked about butyrate earlier. Butyrate heals the colon and lowers inflammation. So butyrate also stimulates the L cells. If you listen to the first half of this talk we did, the L cells release GLP-1s, and GLP-1s make us feel full. That's the drug everybody's taking. We're going to make your own. So resistant starches is great. Fiber diversity. Try different types of fruits and vegetables. Don't eat just cherries or whatever. Shake it up and try different fruits and vegetables. And then berries are great for that, herbs and spices. I'm going to bet that right now you have in your house a spice cabinet full of spices that are probably too old to even have any flavor anymore. Dollar for dollar, ounce for ounce, the best bang for your buck you're going to get from nutrition is from spices. Now, if you're a gardener, grow your own. Grow some dill and add it to your salad. Grow some basil and make a pesto. But if you're not so inclined, that's fine. You can just buy them powdered. Now, Sprouts, which is a grocery store, they have a bunch of them in bulk, really inexpensive, usually organic. So that's a good place to go because many times spices, they're irradiated, so they're not organic. They have problems with that. So start adding more spices to your diet. And when I say spices, it could be anything. Parsley, celery, basil, turmeric, curry. All these are great. Peppers. So eat diversity, not perfection. So eat different things. I am guilty of this. I get hooked on something. I just keep eating and eating it, okay? But I have to shake it up and add diversity. So try different types of lettuces. Try different types of beans. Again, digestive enzymes if you get gassy with them. Try it if you can. I mean, a perfect world, you have 30 different types of plants every week. Now, I don't know if I do that every week. But I have sunflower seeds, I have pumpkin seeds, I have different lettuces, I have carrots, I'll have celery. So it adds up pretty quickly when you start eating a good plant-based diet. If you don't know what to eat, send me an email through the website, drjoe.com, and say, so what can I eat? And I'll send you a lecture that I gave on what you can eat. Again, absolutely free. So protect your gut from future medications. Make the gut healthy. Add probiotics after dosing. So if you have antibiotics or any drug, take the probiotics again. Like if you take drugs in the morning, take the probiotics at night or vice versa. That's the way you can start building it up. And make sure your body's able to detoxify. I take glutathione every day because glutathione helps detoxify my liver. I take super greens every day because chlorella helps detoxify my liver. So I'm always thinking, what's going to be the best food for me? What's going to be the best supplement? What's going to be the cause or the reaction when I take these supplements? And if I have to take medication, what can I do to detoxify? I have a traumatic brain injury. And sometimes my head really hurts bad, so I take acetaminophen, and that seems to help if I can't get adjusted. If I get adjusted, it goes away right away. But if it's a weekend, I'm not around my doctors, then I'll take an extra dose of glutathione to make sure my liver's cleaned out. Extra dose of super greens, clean out my liver. So you just need to be proactive and stop just following, like a robot. I will take my medication, I'll do whatever it says, and that's fine. It's okay if you take the medication, but start detoxifying. Exercise is real important. I don't like exercising. I don't like going to the gym. But walking, housework, yard work, just keeping the body in motion is so important. When I do my radio shows, when I do my podcast, I stand. Make up excuses to keep the body in motion. It's so important to help with detoxification. I take nitric oxide every day to open up my blood vessels to increase my circulation to my liver, to clean the toxic waste products out as well. And I always get my spine, my whole body checked. Because if you have a pinched nerve, that's the core of everything. Your nervous system controls everything. So if you have bones out of place, whether it's your foot, your knee, your hip, your spine, put them back in place. Make sure you're getting enough D3 and K2. Again, it's one of my starter points. Omega-3 fatty acids. So we have the protocols. Minimum would be super green, essential source, B complex, and vitamin D. Then I add omega-3 fatty acids. I add nitric oxide to increase my circulation. I take men's hormone support. I take digestive enzymes. You're thinking, Dr. Joe, that's a lot of supplements. Somebody said to me, that's extreme. That's not extreme. A heart attack is extreme. High blood pressure is extreme. Diabetes is extreme. Impotence is extreme. That's extreme. I don't consider taking a handful of supplements that takes me about 10 seconds to do every day. I don't consider that extreme. And the money you're going to save when you have a healthy nervous system, digestive system, and diet far outweighs any cost that it takes to get the nervous system, digestive system, and diet working. So you're going to win everywhere you turn around. And chances are you're going to live a lot longer too. So why wouldn't you do that?